Welcome to the Rim Break Rodeo. We hope this video helps.
You begin now. Confirm the bottle is correct and not expired, because potency matters. Once ready, clear one nostril by a gentle blow, then sit upright and tilt your head slightly forward so the spray reaches the right area. Make sure to shake the bottle only if the label says to, otherwise skip shaking. Prime the nozzle with 1 to 2 test sprays away from your face to ensure an even mist. This guarantees proper dose and prevents a weak spray when you need it. You now perform the key technique. Hold the bottle upright with your thumb under the base and your index and middle finger on the top. Once in position, insert the nozzle just inside the nostril, aiming slightly outward toward the ear, not straight up. This directs medication to the nasal lining. As you start to spray, breathe in slowly and gently through the nose to carry the mist inward. Once done, pause 5 to 10 seconds between sprays and repeat for the prescribed number of doses to ensure consistent delivery. You finish by wiping the nozzle with a clean tissue, replacing the cap, and storing the bottle upright at the recommended temperature. This protects the spray. Make sure to avoid blowing your nose hard for several minutes so the medication can absorb. If you experience persistent irritation or a nosebleed, stop use and seek clinical advice. If the spray delivers a faint mist, reprime with 1 to 2 test sprays away from your face, and double-check the expiry date before continuing, because an old bottle can fail.
Thanks for watching. Consider subscribing if we helped you.